Hi, I'm Joe Molnar. I'm professor of plastic reconstructive surgery and regenerative medicine at Wake Forest Baptist Health. I'm also the medical director of the Wound Care Center and associate director of the Burn Center. I came to Wake Forest Baptist Health years ago because it was a great academic institution with excellent medical care, and it was also a good place to live. It was a great place to raise my family. Wound care is become one of my passions. It's a true multidisciplinary center in that we have family medicine, vascular surgery, plastic surgery, all involved and employed there in the wound care center. But in addition, we have very close relationships with infectious disease, orthopedic surgery, rheumatology, dermatology, geriatrics, internal medicine, and many other specialties throughout the hospital. In our wound care center, we're able to use very advanced treatments such as artificial skin substitutes, negative pressure wound therapy, which was invented here many years ago. We also have hyperbaric oxygen treatments. Hyperbaric oxygen is the practice where one simply lays in a clear plastic tube under 2 atmospheres or more of pressure for a period of roughly 2 hours. This drives oxygen into the cells, but in addition, it changes the metabolism of the wound so that you improve vascularity and recruit stem cells to improve wound healing. I actually had one specific patient when I was a medical student that stimulated me to become a plastic and reconstructive surgeon. And I was already interested in surgery, and I was preparing a patient for surgery who was not much older than me, who had burn scars. And he told me the stories of where people stayed away from him at the beach, for instance, because he had scars, and they would tell their children to stay away from him. And so I decided to dedicate myself to plastic and reconstructive surgery. And along the way, I discovered that it would be very helpful to have hand surgery training, because this would allow me to do the necessary secondary reconstruction of hand burns, which is a very common problem. In addition, I got microsurgery training because of the possibility of needing that for very complex reconstructive issues. And I also trained in nutritional biochemistry and metabolism at MIT in association with the research I was doing at Shriners Burns Institute in Boston, so that I could integrate my basic science research into the burn field. So I've long been interested in this, and it was all based upon one patient who gave me this inspiration many, many years ago.